The question is that the amendment be agreed to. And I call the Assistant Minister for Defence.
Thank you, Deputy Speaker. I also rise in support of Labor's National Health Amendment Bill, which will freeze the price of PBS medicines to just $25. It's a remarkable thing because it's so important. Why is this so important for the community? Well, apart from the fact that there's so many cost of living pressures that people are facing, this type of support through the medicines is critical to people's lives, their health care. It's fundamental. And we are proud on this side of being the party and the government that stands by working Australians. Because under the Labor government, no one should have to choose between putting food on the table and paying for the medicine that they need to stay healthy. It's fundamental. And the bill delivers on our election commitment to make cheaper medicines even cheaper, Deputy Speaker, by reducing the price of the PBS medicines from $31.60 to just $25. That's a whopping 20% cut in the maximum cost of PBS medicines, which will save Australians over $200 million each year. Now, to put this in perspective, the last time the PBS medicines were this price was over 20 years ago. That's 2004, Deputy Speaker. Now, back in 2004, I don't know where you were, Deputy Speaker, but I remember I had a full head of hair back then, and I was rocking it out to Pearl Jam. I think that was the band of the time. Member for Lyne, do you remember where you were in 2004? You don't want to know. The member for Wannon was probably wandering around listening to rock music or something like that. It was a long time ago, Deputy Speaker, 2004. And I can tell you, times have changed a lot. We don't want to necessarily, I don't think the member for Lyme, myself, or the member for Wannon would want to roll back the clock. We've enjoyed the experiences we've had in the last 20 years. But guess what? We do want to roll back the clock on PBS medicines. That's what we want to roll the clock back. We can be a time machine here, Deputy Speaker, in this parliament. We can go back in time to the cost of PBS medicines back in 2004. Isn't that amazing? Jules Verne would be very proud of us here at the Australian Parliament. So, setting the price of PBS medicines to a figure of $25 that some people, we will remember, but some people might not have even been born in 2004. Now, Deputy Speaker, in all seriousness, since we formed government, Labor has provided Australians with the largest cut to PBS medicines in its history, in the history of the PBS. Thanks to our $689 million investment into the PBS, we have brought down the cost of medicines from $42.50 in January 2023 to just $25 by the beginning of next year. That's remarkable. Making cheaper medicines even cheaper is our way of providing real solutions, real outcomes to easing the cost of living pressures felt by all Australians. Now, unlike those who sit across from us, we are delivering on our promise to bring down the cost of medicines. Now, it doesn't matter whether you live in a metropolitan area or city or most of the rural areas of our vast country, you too will be able to afford the medicines you need most when you need them. Now, I've been door-knocking around my electorate of Wills a fair bit, even after the election as well, just saying g'day to constituents. And I've heard firsthand how cost of living pressures are affecting my constituents. On the doors, I met with a woman, a mum of 4, by the name of Lucinda. Now, Lucinda described to me how her son has recently been diagnosed with epilepsy and that she had to decrease her hours at work to care for her son. She made the choice that she had to look after her child, which meant less work. Now that the joint income of her family has decreased, the family is feeling the pressure of the cost of living even more. So luckily for Lucinda's family, her son's epilepsy medication is one that is listed on the PBS, meaning they will now only have to pay $25 from the beginning of next year, down from $42.50 down to $25 since we started. The time machine is working, Deputy Speaker. To put it into perspective, the same medication in the US without health insurance would be, I don't know if anyone wants to hazard a guess here, I heard 100, $968. $968. If this was ever we needed proof about the brilliance, the importance of the PBS as something that's critical to our healthcare system in Australia, there it is. And thanks to the Albanese Labor government's massive investment into the PBS, families like Lucinda's will have certainty around the cost of medication moving forward. I also met on another occasion a retiree by the name of Alex. Now, in Alex's older years, he's developed high blood pressure. And high blood pressure actually affects about 42% of Australians over the age of 75. Now, if Alec was living in the US, his high blood pressure might go up. His blood pressure might go up because of the politics there. But his high blood pressure medication would cost, I'm going to try again. Anyone know how much this would cost him in the US? $631, close, without health insurance. So in Australia, this medication and the PBS will cost you cost Alex how much? $25. Exactly. You know where this is going. And for pensioners like Alice, it costs even less. Guess what? It's actually not $25 for Alex. We got it wrong. Alex, because he is a pensioner, he will have his medication frozen at only $7.70 until 2030. Now that's much better than $631, isn't it? Lucky for Alex, he doesn't need to afford health insurance to pay for his medicines, because in this country, in Australia, Medicare is for all. It is for all Australians. This is why the Australian people are so passionately committed to Medicare. It is something that is iconic. You know, and those on the other opposite side there on those opposition benches, they just love criticising the PM when he pulls out his Medicare card and so on. But guess what? The Australian people know the importance of that card. When they see that card, they understand what it means to them, to their families, to their health care. And that's why it's so important. That's why we're so committed to it. We will continue to make sure affordable medicines are available for those who need them most. That's why the Labor Party is the party for all Australians. The real tangible relief for every Australian who is deciding what scripts they can refill this week comes through these reductions. And we will continue to ensure no one should have to decide between their health or putting food on the table. That should not be a choice that Lucinda has to make, or Alex, or any Australian, frankly, that they would have to make that choice. Now, while the opposition talk a lot, this side of the House, the government, we deliver. This is what this second term is about. It's delivering for the Australian people on our election commitments, on the things that matter to them, the things that will give them a better life. And this is one of those commitments that we are meeting, making medicines more affordable for every Australian. Deputy Speaker, we haven't just cut the cost of PBS scripts to $25. That's a great thing. This amendment is just another piece in the bigger part of our commitment to delivering cost of living relief through cheaper medicines. As a government, we have already provided 25% cut to the number of scripts a concession patient must fill before the PBS safety net kicks in. We've already established a 60-day prescriptions, saving time and money for millions of Australians. And for the first time in 25 years, frozen the cost of PBS medicines, ensuring co-payments will not rise with inflation. So, Deputy Speaker, thanks to the Albanese Labor government, the cheaper medicines policy, in my own electorate of Wills, and I'm sure this is probably replicated in the member for Lyons' electorate, in all of the members here and across the other side, but in my electorate of Wills, that has already saved over $9 million for the people in my community. Because that's what Labor does, Deputy Speaker. That's what we do. That's what we're here for. It's to deliver on our promises, to make sure healthcare is a right for all and not just a privilege for some. We're always going to fight for a fairer, healthier Australia. This bill, Deputy Speaker, is a practical, compassionate and economically responsible bill. I commend it to the House.